When people hear the word high blood pressure, the first thing that usually comes to mind is medications. And yes, the right medication can be incredibly effective. But that's only part of the story. Some of the powerful ways to lower blood pressure don't come from pharmacy at all. They come from everyday choices, what you eat, how active you are, and the habits that you follow every single day. In fact, lifestyle changes are recommended for everyone with high blood pressure, whether they are taking the medication or not. And some of those changes can reduce blood pressure more than most people realize. And there are many of them in our daily life. Let's begin with one of the biggest suspects people always blame when there is talk about high blood pressure: salt. You have probably heard that eating too much salt can raise blood pressure and may increase the risk of heart attack and strokes. And that's true. Consuming more salt raises blood pressure, and consuming less can cause blood pressure to come down. On average, a reduction of 5 to 6 grams of salt per day can lower systolic blood pressure, or the top number on the blood pressure reading, by around 4 to 5 millimeters Hg in people without hypertension, and by around 5 to 7 millimeters Hg in people with hypertension. And the blood pressure response can vary depending on age, baseline blood pressure, and the overall cardiovascular risks. But even a modest reduction in daily salt intake can produce measurable improvement in blood pressure control over time. Because the table salt is sodium chloride. When you eat it, sodium chloride dissolves in water and dissociate into sodium and chloride ions. Then they get absorbed into the bloodstream. Once sodium enters your bloodstream, water always follows it. And this increases the total volume of fluid circulating in your bloodstream. And more fluid inside blood vessels mean more pressure against the walls of blood vessels. And that pressure against blood vessels wall is exactly what we measure as blood pressure. And importantly, the main driver of blood pressure is not salt as a whole. It's the sodium component. That's why replacing sodium with potassium can make a difference. And a fascinating large study from China showed it clearly. Researchers conducted the salt substitute and stroke study, or SSASS, in China. They enrolled people over 60 or those with history of high blood pressure or stroke. Participants were randomly assigned into two groups. One group used regular table salt, which is almost entirely sodium chloride, and the other group used a salt substitute made of 75% sodium chloride and 25% potassium chloride. In other words, the chloride remained the same, but part of the sodium was replaced with potassium. They followed participants for about 5 years, and the results were interesting. A 14% lower risk of stroke, about a 12% lower risk of major cardiovascular events, including heart attack, heart failure, and stroke, and roughly a 12% lower risk of death from any causes were observed in people who were taking the salt substitute, compared to regular table salt users. The likely explanation is that potassium helps the body excrete excessive sodium through the kidneys, and water follows that sodium out of the bloodstream into the urine, which ultimately reduces blood volume. Potassium may also help relax blood vessels. Together, these effects reduce blood pressure, lower strain on heart, and reduce cardiovascular risks. A 14% reduction in stroke risk and a 12% reduction in mortality is pretty significant. But a simple switch in the type of salt used in everyday cooking can produce these meaningful long-term benefits. However, it is important to be cautious. Potassium-based salt substitutes are not safe for everyone. People with kidney disease or those who are taking certain medication that raises potassium level in the bloodstream should only use them under medical supervision. Because in this group of population, hyperkalemia may occur, which is a dangerous condition. We are putting a lot of time and effort into scripting, recording, and editing these videos, but our channel is still pretty small. If this type of content helps you even a little, give that like button a gentle hit and subscribe. Thank you. The next non-pharmacological approach to bring blood pressure down is called the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. The name may sound complicated, but the idea is surprisingly simple. Eating more whole grains and nutrient-rich foods while reducing food high in saturated fat, added sugar, and sodium. The diet emphasizes on plenty of fruit and vegetables, whole grains instead of refined grains, low-fat or fat-free dairy products, lean protein like fish, poultry, beans, and nuts, and only a small amount of red meat, sweet, and sugary drinks. According to NIH recommendation for a 2,000 calorie per day diet, the DASH eating plan includes about 4 to 5 servings of fruit per day, 4 to 5 servings of vegetable per day, 6 to 8 servings of green, preferably whole grain per day, 2 to 3 servings of low-fat dairy product per day, and 6 or fewer servings per day of lean meat, poultry, and fish. About 4 to 5 servings of nuts, seeds, and legumes per week, and less than 5 servings of sweet per week. Clinical studies have consistently shown that DASH diet can lower blood pressure even without medications. One of the most important randomized controlled trials published in New England Journal of Medicine found that DASH diet can reduce systolic blood pressure by about 5 to 6 mm Hg in people without hypertension and by around 11 mm Hg in people with hypertension compared to a typical Western diet. And when combined with sodium restriction, the effect can become even stronger, with some participants experiencing a reduction of up to 8 to 14 mm Hg in systolic blood pressure depending on baseline intake and blood pressure levels. Then there's fibers. Fibers are part of the plant food that your body cannot fully digest. It is found in beans, oats, vegetables, fruit, and whole grains. But how exactly can fiber lower blood pressure? One theory is that it can reduce inflammation, help regulate blood sugar and cholesterol, and support healthier blood vessels, all of which may contribute to a better blood pressure control and reduce cardiovascular risks. Research suggests that for every addition of 7 grams of dietary fiber per day, cardiovascular disease may decrease by about 9%. And interestingly, scientists are also discovering that fiber may also influence blood pressure through an unexpected pathway: your gut. Inside your gut lives trillions of microorganisms, including bacteria, fungi, and other microbes. Together, they form what is called the gut microbiome. These microscopic residents help digest food, produce beneficial compounds, regulate inflammation, and may even play a role in blood pressure regulation. Researchers believe that some of the blood pressure lowering effect of healthy diet may actually mediate through the change in the gut microbiome. The idea is that diet rich in fruits, vegetables, and fibers shift the balance of microbiome in the gut. And those microbes produce compounds such as short-chain fatty acids, which can reduce inflammation and improve blood vessels function, and potentially lower blood pressure. However, it is important to be clear, it is still an active area of research. While the evidence is promising, scientists have not yet fully determined how large a role the gut microbiome may play in blood pressure control. And it may become an important target for future treatments and dietary strategies, and more research are still needed. But regardless of the exact mechanism, higher fiber intake, especially whole grains, have consistently been associated with lower risk of cardiovascular disease, including in people with high blood pressure. Then there is a blood pressure trick that sounds too simple to be real. At first, it feels like one of those fake social media hacks, but it is actually backed by solid research. It is something you already know how to do, is squeezing something with your hand. Seriously? Studies have shown that isometric hand grip training can lower systolic blood pressure, the top number on the blood pressure reading, by around 5 to 10 mm Hg in people with high blood pressure, which is significant. To put it into perspective, that kind of drop in blood pressure is nearly in the same range as what some people see with blood pressure medication like amlodipine 5 to 10 milligrams. Amlodipine can reduce systolic blood pressure by roughly 8 to 15 millimeters Hg depending on the person and baseline blood pressure. And hand grip training can reduce it by 5 to 10 millimeters Hg depending on the person. The protocol is surprisingly simple. You squeeze a hand grip device called a dynamometer at about 30% of your maximum strength. Hold it for 2 minutes, rest for 1 to 3 minutes, then repeat it and repeat it for 4 cycles. And that's it. No gym and no complex routine. And if you don't have a dynamometer, no problem. You can use a softball or a simple spring hand gripper. The only limitation is that you won't be able to measure that 30%. But honestly, for many people, that's not a bad thing, because turning everything into numbers can sometimes make it more stressful than helpful. The next lifestyle treatment is exercise. Exercise is one of the most powerful long-term tools for lowering blood pressure. But there is something important most people don't realize. Vigorous exercise temporarily raises your blood pressure while you are doing it. This is called the exercise pressure response. Pressure simply means something that raises blood pressure. During the vigorous exercise, a person with normal blood pressure can see their systolic blood pressure, the top number on the blood pressure reading, rise by about 50 millimeters Hg. And that actually makes sense. When you are exercising vigorously, your muscle suddenly needs more oxygen and more energy. So your body increases blood flow by raising cardiac output and blood pressure. And it's a normal protective response. In people with hypertension, this response can be even stronger, sometimes rising by about 75 mm Hg or more. In other words, the body's blood pressure response to exercise becomes exaggerated if someone has high blood pressure. And this exaggerated response can still happen even in people whose resting blood pressure is well controlled with drugs. Now, because of this, vigorous exercise in uncontrolled hypertension needs caution. For example, if systolic blood pressure is above 200 and diastolic is about 110, High-intensity exercise is considered a relative contraindication. That means it is not an absolute never-do thing, but it should be avoided or carefully supervised, because the risk may outweigh the benefit at that exact moment. But don't misunderstand this. People with hypertension should absolutely not avoid exercise. In fact, it is the complete opposite. Regular physical activity is one of the most effective non-drug treatments for high blood pressure and overall cardiovascular health, largely because it lowers blood pressure after you finish your exercise session and in long term. Studies have shown that consistent aerobic exercise can reduce systolic blood pressure by about 5 to 8 mm Hg in many people with hypertension. Resistance training and isometric exercise can add further benefits, and in long run, this translates into lower risk of heart attack, strokes, kidney failure, heart failure, and premature death. So, yes, blood pressure rises during exercise, but over time the body adapts. And that adaptation is exactly where the real benefit comes from. Your resting blood pressure often becomes lower than before you started exercise. Then there's technology. In recent years, researchers have been looking at smartphone apps which is designed to support healthy habits and improve blood pressure. These apps can do a lot of simple but important things. They can record your blood pressure readings, remind you to take medications, encourage physical activity, track your diet, and even give you feedback on your progression over time. Some well-known examples are Smart BP, Blood Pressure Companion, Quadro Health, Omron Connect, and Wedding Helpmeet. Although no app can replace proper medical care or a doctor, but they can make it much easier for people to stay consistent, which is often the hardest part of the treatment. And that consistency matters more than most people think. Randomized controlled trials have shown that these digital apps can actually make a measurable difference. For example, in one study, people using smartphone-based blood pressure management programs lowered their systolic blood pressure by 7 mm Hg more than the control group which were not using these apps after 6 months. And most of those benefits come from better medication adherence and improved lifestyle habits. And this brings up a very important real-world problem. If you look at chronic diseases like hypertension, adherence is often the weakest part of the treatment. The treatment works, but people do not always stick to it. In fact, studies suggest that medication and lifestyle adherence in chronic diseases is often below 50%. That means more than half of the patients are not consistently following the plan that could protect their heart and their brain. And this is exactly where technology can help. When those apps are paired with home blood pressure monitors and simple tracking system, the app can support daily routine, improve awareness, and gently push people toward consistency. Not by replacing care, but by making it harder to forget it. But some people just don't like the ding and dongs of a smartphone every minute. It turns them into anxiety app instead of blood pressure monitoring app, which is not a good thing. Then there is stress. Many people also wonder whether stress reduction technique can actually help with blood pressure. Practices like yoga, mindfulness, meditation, relaxation training, and biofeedback have all become increasingly popular. Biofeedback, for example, is a technique that helps people monitor and sometimes consciously influence certain body functions, something like breathing pattern, heart rate, muscle tension, and more. And while these approaches can definitely help some individuals feel calmer and reduce perceived stress, which can lower blood pressure temporarily, but the long-term evidence for blood pressure reduction is still limited and inconsistent. Then there are natural supplements. Products like garlic extract and fish oil are often marketed as natural solution for heart health and blood pressure control. They might help some people, but they cannot replace the proven prescription medications. For example, a large meta-analysis showed that garlic supplementation may reduce systolic blood pressure measure by about 8 mm Hg and diastolic blood pressure by about 5 mm Hg in people with hypertension. But the quality of the study varies, and the type, dosing, preparation were not consistent across all trials. And we have discussed supplement for lowering blood pressure in more detail in another video. You can check that out later. So, what is the biggest takeaway from all of this? There is no single miracle food, supplement, exercise, or hack that can cure high blood pressure. Instead, long-term blood pressure control comes from something much less exciting but far more powerful, combining many small habits that work together over time. Eating a healthy diet, cutting back on excessive sodium, getting enough potassium from healthy foods when appropriate, increasing fiber intake, staying physically active, maintaining healthy weight and lifestyle, and dozen other small decisions that don't feel important on their own, but repeated day after day, they can quietly protect your heart, your brain, your kidney, and ultimately your quality of life and independence. And if you want to go deeper into blood pressure, there is a dedicated playlist on the channel. You can check that out whenever you have free time. We are making it more comprehensive day by day. Have a good day and night.